A very good afternoon, everyone, and a warm welcome to our Facebook Live today on a very interesting topic, diarrheal disease in children. Allow me to introduce myself. My name is Annabelle. I'm currently a charge nurse at Sangkanchil Children's Ward, Assunta Hospital, and I'll be the moderator for this session. Thank you for joining us today. It's an absolute pleasure to have with me an esteemed and experienced speaker and doctor, Dr. Paranjothy, Consultant Paediatrician at Assunta Hospital. Dr. Paranjothy is a general pediatrician in Assunta Hospital since 1985. He graduated from University Malaya in 1974, MRCP UK Pediatrics in 1980, Diploma in Child Health in 1979, FRCP in 1998. He worked in various hospitals in West Malaysia before working in UK for 2 years. After MRCP, he worked as a lecturer in HKL as part of University Kebangsaan Malaysia before joining Assunta Hospital. His interests are general pediatrics and management of newborn. So here's a little reminder before I hand over the next part of this session to our speaker. If you have any questions during the talk, feel free to type them into the comment box below this live stream. I'll bring the questions up during the Q&A session and they will be answered by our speaker. Also, don't forget to like and share this live video with your friends and family so they too can join us in this live session. Now, without further ado, I welcome Dr. Paranjothy to speak on the topic diarrheal disease in children. Okay, can you
Hello, good evening, everybody. As you all know, diarrhea is a very common, would say, symptom and a sign. Symptom is what you complain about, sign is what you can see. And diarrhea is defined as the passage of loose or watery stools at least 3 times in a 24-hour period. It is consistency rather than frequency of the stools. So many people or many children will have 4 or 5 times motion in a day. But if the stools are not watery or loose, you don't call it diarrhea. At the same time, they may have once in 2-3 days, but if it is pasty, it is still not diarrhea. Now, diarrhea is one of the commonest symptoms which many mothers would face, besides fever, besides cough, a little bit of vomiting, you see. So, you can have diarrhea alone or in combination with fever, with vomiting, and sometimes with even cough and very rarely fits. Now, the nature of the stools can vary both in adults as well as children. That includes even babies. So on the one hand, if you have severe hard stools, something like balls, you call it like Malaysian, you may call it like mata kucing, round balls. Or on the other hand, you can have very watery stools, almost like passing urine. But only thing is, it's coming out through the anus. Now, in between, you will have normal stools, which is soft and snaky or sausage-like. And sometimes, if it becomes a bit loose, it becomes mushy. Now, what are the causes of diarrhea? Most of the time, the diarrhea is due to an infection. And most of the infection are due to viruses. The common virus that we have seen in Malaysia in a study which we did is rotavirus. Rotavirus accounts for about 40% of all diarrheas. And this is commonly spread by oral fecal route. For that matter, most infectious diarrheas are due to oral fecal transmission. In some other parts of the world, and including Malaysia, the second commonest virus is norovirus, and other viruses are available. Now, among the bacteria that you can see, commonest would be bacteria called Salmonella, E. coli, or Escherichia coli. You get Shigella, you get Campylobacter. These are different names, which may not mean much to you all, but this would be shown to us by the laboratory, who will take a sample of the stool and grow it on certain culture plates. Now, among the other causes would be parasites, which are like amoeba, which are unicellular organisms, and then giardia, which are also a unicellular organism. Many of you would have seen it under ordinary microscope, a light microscope, which magnifies the cell or the organism by about 1,000 or 2,000 times. Whereas if it was a virus, you have to see it under an electron microscope, which magnifies this pathogens 100,000 times. You can't see it directly through the eye, but it's seen and photographed, and you can see. Now, besides infectious organisms commonly causing diarrhea, there will be other causes. And one of the commonest causes would be food poisoning. Food poisoning is due to contamination of food, usually meat, like uncooked pork or uncooked beef, whole eggs, and also sometimes vegetables which have been not cooked properly, which have been contaminated with water, which has been again contaminated with sewage. Okay, so food poisoning is one of the other causes of diarrhea. But again, in food poisoning, you will have other members of the family who would have consumed the food, who would come and complain of having loose motion. For example, even the adults may have it, the parents who have gone to a restaurant, or sometimes in outbreaks, certain nurseries, you can have this kind of food poisoning. Now, besides food poisoning, you get non-common causes of diarrhea, which are, should not always think that diarrhea is due to a common pathogen. It can be due to other causes like urinary tract infection, which can present as just watery stools, or in a small newborn baby, a, a septic child or a child who has had blood infection can present as diarrhea, which may be just a symptom of the entire illness. Rarely you can have surgical causes such as acute appendicitis presenting as a simple diarrhea. Some of the microorganisms, as I mentioned earlier, that can cause diarrhea would be viruses, and commonly we have things like rotavirus, which is, by the very name, it's like a wheel or a round shape. Then smaller than that will be norovirus and the other viruses. These are all electron microscope photographs of viruses, which are magnified 100,000 times. Now, other common bacteria would be Salmonella. Now, when we say Salmonella, you should not confuse it with typhoid Salmonella, which is Salmonella typhi. This is non-typhoid related Salmonella. Now, other bacteria would be E. coli, which is commonly found in feces, Campylobacter, also a fecal organism, Shigella, and Clostridium difficile, which is one of the common causes of antibiotic associated diarrhea. Rarely in the travelers or in the rural areas, you might get parasites such as Giardia, Cryptosporidium, and amoebiasis due to Entamoeba histolytica. Now, all these diarrheas will present with, besides loose motion, other symptoms, and the commonest symptoms would be vomiting. Now, any offending organism that you swallow or you consume, it will be the first port of entry will be the stomach, and so the body tends to reject it by vomiting it out. And so, vomiting is a common symptom, and at an early stage, there may not be diarrhea. And so, when the child starts vomiting, the parents are a bit confused. Is it due to diarrhea or is it due to some other illness? Together with vomiting, you may have fever, you may have abdominal pain. And as the offending food goes down from the stomach to the small intestine and to the larger intestine, the body tends to promote expulsion of this offending organism by causing increased peristalsis, and so you give rise to abdominal pain. And this pain is intermittent in nature, colicky as we call it. It comes and goes, crampy, and associated with that may be fever. Now, as the offending organism goes down, it causes expulsion of the organism, and this creates watery stools, diarrhea. And one of the common effects of diarrhea will be loss of fluids causing dehydration. Now, you must understand that a sick child is not going to eat or drink. So, there is not only inadequate intake of fluids, but there is also loss of fluids through vomiting, through diarrhea, and through the skin, through fever. So all these factors add together and cause a dehydrated child. It's just like a plant, if you don't water the plant, it withers. And if you put it under the hot sun, it further withers. Something like similar to that kind of logic. Yeah? So one of the features of diarrhea will be sunken fontanelles. Now, fontanelles are the gap found in the front part of the skull, and if you feel it, it is normally in level or a little bulgy, but it can be depressed. Again, the child, if he cries, there won't be any tears. The eyes, instead of appearing normal, will be sunken. The tongue will be dry, and the skin, if you press the skin to pinch it to form a tent, it will normally snap back immediately, but here it will take a few seconds to get back to its tone. So the skin turgor is poor, the urine output is poor, and a bubbly child will be very irritable. If not, he will be very apathetic. Okay, his breathing also can go from normal breathing to rapid breathing or deep gasping breathing. Now, traditionally, we used to kind of grade the degree of dehydration between mild, moderate, and severe dehydration. Uh, of course, this is to help us to quantify the amount of dehydration and calculate the amount of fluids that we may have to give. For all practical purposes, if a child is helpful and healthy and crying and just has passed a few motion and he's still drinking, then it's mild or mild to moderate. But on the other hand, if he's irritable and not drinking and he looks very ill and his pulses are weak and his skin is a bit mottled and grayish, then you would say he is almost going into a state of what we call shock or severe dehydration. So, what are the complications or what can happen if you don't treat diarrhea? The commonest, the biggest, and the most important is, as I mentioned earlier, loss of fluids and resulting in dehydration, which can lead to shock and can, if not treated, lead to death. Now, also coming together with dehydration will be electrolyte upset or low electrolytes. One of the commonest electrolytes that will be affected will be potassium, which if it is low can cause the child to have very weak muscles. He may not be moving his limbs and the abdomen will get distended and gaseous. So you may have to correct the low potassium. Together with potassium is sodium. A low sodium will result in a lethargic child, and this can most of the time result in either a normal child or rarely fits. A high potassium, a high sodium, sorry, can also result in fits. Now, how do you get high sodium? That's because we are, in our effort to correct the diarrhea, we are giving fluids which are high in sodium, which can be due to fizzy drinks, or it can even be due to overzealous packing of the milk. Instead of giving the normal scoop to water ratio, you pack you give extra scoops so that in your misguided attempts to increase the nutrition of the baby. So you can get fits. Now, fits can be frightening. Now, fits in children, besides the low sodium, can be due to just fever itself. So a diarrhea can come with fever, and the fever itself can cause fits in certain children who are prone to fits. This is what we call febrile fits. Okay, ongoing diarrhea can result in irritation of the anus and perianal area. The contact of the skin of the perianal area with urine and fecal matter results in redness, and if the redness is long enough, it can further result in superinfection with yeast and fungi, causing severe loss of skin and painful motion. Now, if the diarrhea continues, usually most of the diarrhea will stop in less than a week, sometimes 2 days, sometimes 3 days, and it's usually a self-limiting condition. Self-limiting is a word we use to say that it stops by itself. Whatever you do, it will stop by itself. But in some instances, it is prolonged and gives rise to all these complications. So if it goes on for more than 2 weeks, we call it chronic diarrhea. So how do we manage a child who is having diarrhea? Management does not necessarily mean must give medications, but can be other medications, other modes of treatment. Huh? So most important is to give back the fluids and the salt-rich liquid that has been coming out of the baby. So you can give it either orally or by a drip. Now, 95% of all diarrheal cases can be managed by oral replacement of the fluids. Now, if it is a small baby who is breastfed, please do not stop breastfeeding. Continue breastfeeding. Breastfeeding is not only providing the food, it's also providing the fluids and also other important immunological factors. Now, if the child is also, besides breastfeeding, is also on other food, you can add on oral rehydration salts or oral rehydration therapy. Now, this is available in the market. It can be bought without prescription, ORS, and this is designed by the World Health Organization to have a particular concentration or osmolarity, which is about 245 or 250 millimoles per liter, so that the moment you reconstitute it, it's absorbed very rapidly like a syringe into the body and replaces the losses. Okay, so this is oral rehydration solution, especially meant for smaller children. Now, if it is a bigger child and you find that it's not available, then you can even make isotonic drinks, which are the osmolarity there is more than 245, it is 300 or more, and that's good enough. Just give the drinks, isotonic drinks such as 100 plus or Revive or whatever you have, but do not give the normal high sugary drinks like juices and all that, which are very high in sugar, because that will go and create an osmosis and suck fluids from the blood into the intestine and make the diarrhea worse. Now, another common, especially in the rural areas, is rice water. Now, in the urban areas, in the cities, we all make rice with the rice pot, which is electronic or electrical rice pot. But in the good old days, we used to make rice in a pot by a burner, put one part of rice and two parts of water or accordingly. And once the rice is cooked, we decant the rice water, and this rice water has been proven by the World Health Organization in several parts of the underdeveloped world to be as good as oral rehydrating salt, if not even better, because the rice water has got amino acids like glycine, and you can add on a little pinch of salt to taste to make it even more better. Now, at the same time, do not stop your food. You just can give back replace your losses with rice water or oral rehydration salt, but continue giving your rice porridge if it's possible. Give the starchy porridge like porridge with potatoes, carrots, which contains complex carbohydrates which are easily digested. Now, only when oral methods fail and the child is in having going into a state of probably dehydration and shock, or he has other complications like fits, or he's a very small baby, that you have to admit to the hospital and start on intravenous fluid therapy. So that is the main mode of treatment. Besides that, medications can be used. Commonly used medications will be adsorbents. Adsorbents are like clay, from the clay, derived from clay kind of medications. A commonly used one currently is Smecta, which is silicates, and then you have got kaolin and so on. Okay, this can be used for bigger children, especially above 2 years of age. Another commonly used medication will be Resica Dotril. It goes under the trade name of Hydrosac. which is used for children below 2 years also. Again, it has got different strengths, 10 milligram, 30 milligram, can be used 2 or 3 times a day. A bigger child can use loperamide or Imodium. Probiotics recently has come into the treatment of diarrhea, and it has been shown that certain fungi like Saccharomyces boulardii or certain bacteria like Lactobacillus or Bifidobacteria helps to reset the intestinal bacterial milieu or the whole environment of the intestines, which has been upset by this diarrhea. You know, our intestine has got millions and millions of good bacteria which coexist with the human being, and when you upset this bacteria by certain bad bacteria, then you create this disease. Now, the use of antibiotics is generally not needed. In fact, sometimes can make it worse only when you prove a certain microbacteria, certain bacteria which I mentioned earlier, like Shigella, or Salmonella, or Campylobacter, then you can use antibiotics. Or if it's a very small baby in the first 3 months of life, where you don't know whether the diarrhea is part of a generalized septicemia, then you can use intravenous antibiotics. Otherwise, generally, antibiotics are not necessary, if not can be harmful because they can cause antibiotic associated diarrhea. Now, certain parasites which can cause chronic diarrhea or even acute diarrhea like Giardia, which is part of the tropical, the rural areas, even for that matter, even in West Malaysia, you go into the deep kampongs or you start swimming in the pools, or in East Malaysia, if you go into the remote parts, there is a risk of getting parasitic protozoal diarrhea like amoebiasis, giardia, and cryptosporidium, for which you need special anti-parasitic medications. So, generally, as I mentioned earlier, the most important is dehydration, for which you have to rehydrate, continue breastfeeding, and then sometimes you can add on certain medications to reduce the diarrhea. Rarely, you may have to have special milk formula. Most of the time, normal milk is enough. You continue with your normal milk feeding if the child is not dehydrated and the diarrhea is less than 2 or 3 days. But sometimes you may have to use certain low lactose formula. Now, why do you use low lactose formula? Because when the pathogen, whether it's a bacteria or a virus, enters the small intestine, then, as you know, the small intestine has got finger-like projections called villi, and at the tip of these villi are certain brush borders, like a brush that you use to paint, which are just hair-like projections. And in the tip of these hair-like projections are the enzymes that will hydrolyze the sugar of your milk, which is lactose is hydrolyzed to sucrose, glucose and galactose. So these lactases, the enzymes are called lactases, are usually destroyed by these viruses or offending bacteria, and gives rise to a lot of lactose, which will then suck out all the fluids from the blood and create an osmotic diarrhea. So very rarely we may have to use low lactose formula, but generally we don't have to use this. Rarely also, if the diarrhea persists and becomes chronic, then the entire villi in the small intestine, either partially or in patches, can be denuded, and this gives rise to cow's milk protein intolerance. And most of the formula that we use today are derived from cow's milk, which is made into powder. Okay, so in this kind of situations, you may have to not only remove your lactose, but you may have to remove your cow's milk. And so we resort to isomil or soy formula. You can see the common isomil brand in this photo. Now, sometimes not only is there cow's milk protein intolerance, but there's also lactose intolerance, and the entire intestine is as though it has been shaved off all the villi, and may have to resort to very hydrolyzed milk protein. Now, as you know, the proteins in the milk is all made up of amino acids, which are then coiled like a spring. Now, when you enzymatically cut these amino acids into small, small portions, then you form extensively hydrolyzed milk proteins. And commonly, what is available is a brand called progestamil. There are other brands also. But only thing is, some of these milk tastes a little bitter, and for a small baby, I guess they are okay. But for bigger children, it will be a bit difficult to drink. Now, even if this fails, then you have got pure amino acid formula, which are all broken down enzymatically, and you can buy these. They are quite expensive, and it can be used. An example of this is Neocate. Now, if all milk formula does not work and the child is still producing or having continuous diarrhea, the child will then become not only dehydrated but malnourished, and you may have to resort to intravenous alimentation or intravenous feeding, which is sometimes used if their child has got chronic diarrhea. Now, you must understand that we are living in an urban environment where most of us are reasonably well off. Now, if you go into in the remote areas of Malaysia, for whether it's east or west, or if you go to, say, the underdeveloped countries of Africa and Asia, like Bangladesh or India, you will find that recurrent diarrhea causes severe malnutrition, and that results in what we call kwashiorkor or marasmus. Children who are literally starving to death, you know, and that is a whole different topic altogether. And that recurrent diarrhea can cause malnutrition, and malnutrition can also predispose to recurrent diarrhea. So, most of the times, nothing happens. We are able to manage at home, but how do we prevent diarrhea? Very important. If you are breastfeeding, continue breastfeeding. All the oral rehydrating salts are not necessary. If you continue breastfeeding, you can use these ORS and other forms of rehydration as a supplement or top up. Now, second is milk preparation and hygienic milk preparation. That means you must wash your hands properly, use boiled water, and use aseptic methods of making your milk. And the bottles must be clean, must be brushed, must be either boiled, or you can use other chemical methods of cleaning your bottles. And the water supply, let's face it, must be clean. Now, of the last maybe 10 or 15 years, we have had vaccines which can protect the baby from rotavirus, which is the commonest cause of diarrhea in Malaysia as well as worldwide. And there are two types of rotavirus vaccine. One is called Rotatec, and the other one is called Rotarix. Rotatec is a 3-dose vaccine, which is a composite of 5 different subgroups of rotavirus, whereas Rotarix is a 2-dose vaccine, which is derived from a single group of rotavirus. Now, these rotavirus vaccines must be given before 5 months of age, after which it is not advisable to give this. So overall, diarrheal disease in childhood is very common, can masquerade as part of other diseases, and it can be most of the time managed at home. Very rarely you need to admit the child to the hospital and manage it in the hospital setting. Thank you very much.
Thank you, Dr. Paran, for the interesting and informative talk. I've learned so much already about diarrheal disease. Looks like there are quite a number of questions from our viewers. So let's dive straight in, shall we, Dr. Paran? All right. We go to the first question from Becky Lau. At what point do I need to bring my child to the hospital?
You see, diarrhea is a very common symptom, as I mentioned. And if the child is feeding, depend again on the age of the child. If it's a baby, if you're breastfeeding, just continue breastfeeding. The child is drinking and sucking, you don't have to bring him to the hospital. Okay? It's self-limiting. The word self-limiting means it stops by itself. Okay? You don't even have to do lab tests and take stools for checking and so on. But if he's not feeding, if he has fever, if he's fits, then you may, well, fits doesn't, you can't go to a general practitioner, you may come straight to a hospital. But otherwise, if it's fever and persistent diarrhea, you can go and see your GP, who will then assess the child and treat accordingly.
Thank you, Dr. Paran. We'll go to the second question. Okay. Jukuma Te asked, can I give my child yogurt drinks? Will it make the diarrhea worse?
Yogurt drinks are okay, good. But only thing is, some of this commercial yogurt may have high sugar in it. So you may, if you make your own home cooked yogurt or non-sugary plain yogurt, yeah, why not? You can give it as a drink, or you can just give it as a scoop.
Now, before we go on to the next question, for all of us who are live today, you may still submit your questions via the comment box below, and do keep the questions coming. So our next question, okay, is from Tan Chu Jing. They ask, in some AGE cases, doctor will prescribe antibiotic and probiotics for patients. These two medications can take at the same time or must give a gap of a period of time.
Yeah, you see, as I mentioned in my talk, antibiotics are definitely not prescribed for simple, straightforward diarrhea, unless the doctor finds something other than a diarrhea, like for example, he has got cellulitis or has got urinary tract infection, then in which case he may have to use antibiotics. Now, probiotics are nowadays being used almost like a nutritional supplement. You can take it every day. But over and above that, it has been found to be specially useful for diarrheal diseases. And usually it's given once a day. So probiotics can be given as as a supplement and as a treatment for diarrhea. Antibiotics again depends on what the particular doctor has seen, and maybe he has decided to use it for acute tonsillitis or some other cause. And again, he will try to choose an antibiotic which by itself doesn't cause diarrhea. So try to separate them at two different times.
How many hours interval, Dr. Paran?
I
Would you
can't tell you
recommend?
that, but maybe a few hours, 3, 4 hours apart,
Okay.
allow it to be absorbed, and then
Okay. We go to the next question. So, from Rosalie Ross, Dr. Paran, may I know what are the foods that can make diarrhea worse?
two things lah. One is high sugary foods, make it worse. Milo is very concentrated with sugar. Let alone Milo without sugar is by itself high in sugar. You add sugar to it, it's worse. Condensed milk, nowadays we don't use condensed milk at all. Uh, and then anything which is very oily and fatty, try to avoid it. Otherwise, and then high roughage during diarrheal episode is not advisable. Give something which is like a porridge, rice is very good. Even you can add fish and chicken if it is in very mushy or overcooked form. Rice porridge, fish porridge, chicken porridge, any form of porridge, starchy like potatoes, carrots, even plain biscuits can be used. Okay.
The next question. Uh, the next sender is Rachel Lu. My son is 10 years old and he doesn't like ORS. What can I give him?
He doesn't like ORS, then give him the what do you call this saline isotonic fluids like 100 plus or Revive or similar. Just shake up a bit of the fizz and you can give it to him. Nowadays you have 100 plus, which is a bit of what do you call this? It's got some green ones which are lime flavored or lemon flavored.
Our next question. This one. Okay. From Mr. Hishamuddin Jafar. If a baby is having diarrhea, which milk powder do I give and how do I decide?
You decide to continue with your normal milk powder, lah, whatever milk that you are taking. And usually it's diarrhea is, as I mentioned again, self-limiting. It stops by itself. Whatever you do, the body will look after itself. So you don't have to go and visit a doctor and can save your money and save your milk powder. But if it persists for more than 2 or 3 days, or even if there is persistent vomiting and high fever, then you see a doctor. Sometimes he may want to introduce a low lactose formula. As I mentioned earlier, there are several brands where the lactose is reduced, but not zero. It is reduced in its content. You like Enfalac LF, you have Similac LF, whatever that's available in the pharmacy, you can use that LF, low lactose brand, lactose free or lactose reduced formula. Then, if it is very serious, then he may want to refer you to the hospital where we may want to see a pediatrician who may want to admit it or take a stool culture and recommend other formulas, special formulas, we call it, like isomil, like progestamil, or whatever.
We will look at another question. Okay, the sender Jasmine asked, children at what age need to give rotavirus vaccine? Is it necessary to take the vaccine?
Oh, rotavirus vaccine has been in the scene for the last maybe 10 or 15 years. And as I mentioned the earlier vaccines developed used to cause what we call intersusception. For that reason alone, intersusception was common at the age of 5 or 6 years. That initial vaccines were withdrawn, and more recent vaccines that are used, Rotatec, Rotarix, and there are one or two other commercial brands. This must be used before 5 months of age. Earliest is 6 weeks. Hmm? And rotavirus can cause severe dehydration, vomiting, and a lot of man hours lost in the process of trying to treat the child with diarrhea. And it has reduced severely the admission rates to the hospital.
Okay, there are two senders who asked around the same question. Sender Punamala, Doctor, please guide vaccination, and Miss Tivia, if my child already got rotavirus infection, is it really necessary to take the vaccine still
Yes,
after they've
yes,
got?
yes. Because the protection from rotavirus is just a limited protection, whereas vaccination gives you long protection. And most of the rotaviruses are causing illnesses in children below 2 years of age, particularly below a year of age, where dehydration is a big problem. Whereas in a bigger children or an adult, dehydration is nothing like. Whereas in smaller child, because of the large surface area to his weight, it causes severe problems which can lead to shock and so on. So, if you can help it, rotavirus vaccine is a very important vaccine. Uh, it is, I think, about 135 ringgit in our hospital. May vary around there, lah. 3 doses of Rotatec or 2 doses of Rotarix, which may cost a bit higher.
The next question from sender Fulan Sami. He asked, Doctor, is it necessary to dilute the formula milk during diarrhea? Thank you very much.
Okay, that used to be the teaching about 20 years ago to give dilute milk, but nowadays it's not necessary to dilute the milk. We don't advise you to dilute the milk. Just continue giving the normal milk feeds. It's important because milk is both fluid and food. So you continue nourishing the child. If you know how to give ors, or you can make your own rice water in the house, you can in between supplement your milk feeds or substitute certain amount of milk feeds, say one milk feed with one ors, like that, alternate it, and give it just for a day, after which it will most of the times settle.
Okay.
So no need to dilute your milk feeds.
There are few senders who also ask the same question as this sender Rosalie. Is it a good practice to give probiotic as a supplement every day? Earlier, the sender asked regarding while they were ill. So, if they are not ill, I think this is a question.
Well, if you can afford it, why not give supplements every day? You can't afford it, not necessary. Just take yogurt.
Okay. So, do we have any more questions? No. Okay, in the interest of time, I'm afraid we will not be able to address any more questions. Thank you for keeping the questions coming, and we seek to answer the rest of the questions by replying to your comments. We have reached the end of our live talk today. Thank you once again to our speaker, Dr. Paranjothy, for giving us an in-depth look into diarrheal disease in children. Thank you all for staying here with us throughout this session, and I hope you have benefited from this talk as much as I have. For further details, please read the full article which will be available in the Assunta Facebook page. Take care and bye bye.
Thank you. Thank you.